my name's Maggie and I'm here to talk to you about a problem that you may feel a little bit embarrassed about, and that's vaginal dryness. So why am I here to talk to you about vaginal dryness? Well, I've been a nurse for more years than I care to admit, and I worked in cancer care for over 20 years. But it was after my own experience with breast cancer 8 years ago that I realised that vaginal dryness was a problem that wasn't very well discussed, but it was a problem that many women after breast cancer did experience. So that's why I'm here to talk to you today about how vaginal dryness may affect you. It might not be affecting you now, but it's a very strong possibility it's something that you may experience in the future. And I want you to know about the solutions that are available to you after your breast cancer treatment. So vaginal dryness is something that actually many women may suffer with throughout their lifetime, but mostly it's something that women experience around the age of the menopause, about the age of 51. The menopause is when your natural estrogen levels are in decline, and this can lead to all sorts of menopausal problems, and some of them you may have discussed already. So hot flushes is an example of one that's talked about a lot, but vaginal dryness is one of the ones that's not very often discussed, but it is a symptom of the menopause, and as I say, it's most often occurs around the natural age of the menopause. But as a breast cancer patient or someone who's experienced breast cancer and had breast cancer treatment, it may be that you're being affected earlier than this. It could be because you've been through chemotherapy, it could be because you've had to have your ovaries removed, or it could be because you're on anti-estrogen therapies. All these things may lead you to be experiencing vaginal dryness. It could be that you've been through the menopause already, but because you're on some of these drugs now, you're experiencing these menopausal symptoms again. So what happens to the vagina when you've got a decline in estrogen? Well, when we have estrogen naturally throughout our lifetime, this keeps the vagina moist, and you have a thin layer of clear fluid that keeps our vaginas lubricated. When estrogen is in decline, this lubrication naturally diminishes. The walls of the vagina become thinner and drier and less elastic. The area around the vagina and the genital area is thinner and less well supported. This can lead to everyday discomfort. It can lead to women experiencing problems with friction when they're walking, when they're playing sports. And of course, it can lead to painful sexual intercourse. Now, painful sexual intercourse may mean that you start avoiding sex. It may mean that you don't discuss it with your partner. This can lead to all sorts of relationship issues. So it's really important that you know what you can do about it, and how you can increase your vaginal lubrication. So you've all had bags of little yellow bag of Pure Med samples, and you've got the range of samples within the bag. Now, 8 years ago when I had breast cancer, I didn't really get the advice that I needed about vaginal dryness. And it was only after I saw a gynecologist and I plucked up courage and said, can you please help me and tell me what I can do about this problem that I've got? And he said, in his opinion, the only lubricant that was available to help a woman was Pure Med. So of course I went out and bought some Pure Med and tried it, and it was a perfect solution for me. I realised that if it was helping me, I could help other people. So I then wrote to the company and asked them to provide samples for my patients at that time, and subsequently I'm now working for the company. That's because I really believe in the products and the benefits that they can bring to you as a woman with vaginal dryness. PureMed produce a range of 6 different lubricants, 2 that contain silicone and 4 water-based lubricants. Silicone makes a really good lubricant because silicone can't be absorbed, so it sits on the vaginal wall and creates a lovely silky lubrication. So it's really, really good for women who are experiencing everyday discomfort, who have got friction within their vagina. So using the PureMed will reduce that friction. And of course, it's an excellent lubricant for sexual intercourse. So if you're using it for sexual intercourse, it needs to be put inside the vagina and ideally on your partner's penis. There are 2 silicone lubricants, Premium Glide and one called Soft Glide, and they're both excellent lubricants if you want to have an everyday solution for this problem. It doesn't cause any irritation because silicone can't be absorbed. There's no chance of irritation. Silicone, it's washed away very naturally. There's no clumping, there's no sticky residue that makes you uncomfortable down below, like some of the lubricants can cause clumping and discomfort. So a really, really good solution for vaginal dryness. All our lubricants are paraben free, they're all perfume free, and they're all hormone free, so completely safe after breast cancer treatment. Then there are 4 different types of water-based lubricants, all excellent lubricants, very good for sexual intercourse. The Repair Glide contains hyaluronic acid. You might have heard of that. It's in some creams that help our wrinkles, etc. And hyaluronic acid sort of helps bind extra water, so it makes it a really regenerative lubricant. That's really good if you've got little cuts or little sores within the vagina. There's also 3 other lubricants. One's called Natural, that contains glycerin. Another one is called Sensitive, so no preservatives at all within that one. So excellent if you've got dry and irritated skin. And then there's the Vegan Glide. So that one is no testing on animals at all. And so is excellent and obviously a great solution if you're a vegan or a vegetarian. All our lubricants are paraben free, they're all perfume free, and they're all hormone free, so completely safe after breast cancer treatment. Please discuss any of these issues with your breast care nurse. She really will be very happy to talk to you about these issues. So give them a go, see how you get on, and I'd love to know if you've got any feedback or any comments, then please let me know. Thanks for listening and goodbye.